Those who have joined late, please help them out with the page numbers and topic name. Diet in obesity and underweight. Chapter 15 in dietetics. So the prevalence of obesity, okay, it is rising. The trend of obesity in the worldwide population is rising. Okay, people are getting more and more obese, usually in the developed countries as compared to underdeveloped countries. Okay, the countries which have higher GDP, they have high risk of most of the obese population. So common symptoms in adults who are obese, there will be sweating that is more than usual, snoring or trouble during sleeping, even sleep apnea, okay, disturbance in sleep or breathing difficulty during when they lie down, okay. But when they elevate their chest, when they elevate, use little bit of pillows and they elevate their neck and little bit elevation under the chest, that could relieve them, okay. So that is sleep apnea, shortness of breath, even if they do small physical activity, they feel shortness of breath. And there are skin problems like dilated veins, bluish green veins, capillaries that are quite visible on the thighs, okay, upper thighs, any areas of the thighs. Sometimes in the calf region also you can see these spider veins, okay. It starts like spider veins and then later it can contribute to varicose vein, etc. Okay, so these are the common symptoms in adults. In adolescents, acanthosis nigraris, it's a very dark velvety skin, okay. So you see some, usually in pregnancy also these things do take place, but after post pregnancy the skin get lighter, okay. In some women the skin near the neck, the base of the neck, it gets dark and velvety, okay. Even if the person is not sweating, it, this particular skin has a kind of sheen to it, okay. So this is called as acanthosis nigricans. So in adolescents, this is a very common feature when the adolescents start put on weight. Also hormones also trigger this, okay. Why specifically in adolescents? When you want to treat acanthosis nigricans, you have to check, get your blood work done, because majorly your hormones will impact the presence of this particular dark base or base color neck, okay. Sleep apnea, same like adults. Shortness of breath with even a small physical activity. Stretch marks, the spider veins are more common in adults, okay. And stretch marks are more common in adolescents, even for adolescents, teenagers who are not obese, okay, who are quite healthy. Most commonly in women, okay, when a child, when a girl attains puberty, okay, even before she attains puberty, when her body is developing, you will start noticing stretch marks here and there in the body. It may not be related to weight gain, it may not be related to obesity or overweightness. Usually it is the sudden growth spurt, okay. Growth spurts will lead to some or the other kinds of stretch marks, so try to differentiate it. Every teenager who has stretch mark doesn't mean that he or she is overweight, okay. Growth spurts will also lead to stretch marks, okay. Then we have morbid obesity, that is like, here we require treatment, the patient requires weight management, otherwise vital organs may get affected in the long run. So chronic breathing difficulty, a person who is more than 100 pounds in weight, okay, if you convert 100 pounds into kilograms, you will get the answer to it. Difficulty even to walk properly, okay. Forget about the physical activity, even brisk walking or walking within their household becomes difficult for them, okay. So BMI with compared to age, as your BMI slightly increases, your BMI should not peak along with your age, okay. You can see the trend of this graph, the green part of the graph which you can see, okay. The your weight should be little bit, you should be little bit plump when you are born, okay. During the childhood your weight will reduce because you are growing, you are physically active. And when you reach towards adulthood, when your age increases slowly and steadily, you can see how the green, this 4 green area of the BMI versus age is going, it's a very steady increase. Okay, and yellow is overweight. Okay, there is an increase, but it's little bit more abrupt. Okay, and a person who is obese or underweight, the red demarcations which you can see over and below there is a tiny stroke of um, a red line, that is underweight, and on top of it you can see uh, getting rid of stretch marks. There are various laser interventions. Okay, topical creams, they claim that they affect on stretch marks, or some topical oils and creams, they do not have any reasonable visible effect. Okay, the skin around that area, because of your regular massage, may get better, and it gives you it does not treat the stretch mark, but it gives you a shiny appearance which will create an illusion that the skin does not have that depth of a stretch mark. Okay, so stretch mark is an internal scarring. Okay, so internal scarring, like if you get a small scratch somewhere on top of your hand on the epidermis, okay, within 2 or 3 days it will heal, and that area will be completely as new. But when you have the same kind of scarring in a very internal layers of your skin, okay, starting from the dermis, okay, not just the epidermis but also the dermis, healing them from within, and just by using topical oils or creams are not optional. Okay, so that is the reason why healing stretch marks or treating stretch marks, usually it may require some surgical as well as laser interventions. And even with laser interventions, you have to be very regular with that. Okay, once a month or once 3 months, something like that, is the laser intervention done for stretch mark. Okay, so you have to be very regular with that, because you are treating a scar which is under the skin. Okay, so no, don't depend on some topical medications. Okay, topical medications will not help. So that's about stretch marks. Yeah, where were we? Yeah, so when you see this red area, okay, along with the age, there is a sudden increase in the body mass index. Okay, that is the height and weight of the child is suddenly increasing. Obviously there would be a growth spurt as well, so that would lead to obesity. So that's about the graph. Next, coming to the factors that lead to your risk of getting obesity. So genetic factors influences most of the 50 to 70% of cases. If you have like your family members, obesity runs in your family, there are high chances that you may also fall victim to it. Then we have age and sex. It can occur at any age. Obesity does not have a very set age. Nowadays, even in small children who had just stopped having breast milk and they are being weaned into regular food, even in such small children, 1 year old age child and all, you will see obese children. Okay, overfeeding by parents, that could lead to infantile obesity. So yeah, it does not have a specific age when it starts. But females have higher tendency to be obese. The rate of obesity is higher in females as compared to males, and that is highly because of their hormones. Then we have eating habit. Okay, too much of snacking in between your major meals. Okay, some people eat fast and they don't chew their food adequately. If the mastication process is not adequate, your body, your brain will think that, okay, enough bites have not been taken, we require more bites, so the brain will not allow the body to feel satiated, so you may overeat. Okay, eating faster and not chewing properly. Okay, at least see 32 times you have to chew it, they say, but when you are in a very routine kind of lifestyle, it's not healthy to practice that much amount of time in just one meal. Okay, at least 20 times chewing a morsel of food 20 times would be more than enough. Okay, so eating faster and not chewing properly could lead to overeating, which further leads to obesity. Then the housewives who are fond of cooking a variety of food, or people who are working in the kitchen, and when they are cooking delicious meals and all, in between cooking they will taste and taste, and they will have a small morsel of food, some small portion of food, and along with their family they will sit and eat. And if the family does not finish their food, the housewife will try to finish it, so that she does not want to waste the food or something like that. So that could lead to obesity. So various eating habits they have mentioned on page number 291. Very interesting statements. Just go through that. Okay, you will get an insight about it. No need to buy heart anything, just like a novel read that these points we have listed down on page number 291. Okay, having too much of processed concentrated food, high in fat, sucrose, etc., and low water consumption, people who drink very little amount of water, they have higher chances of being obese. Then physical activity, people who live a sedentary lifestyle, they and who people who do not pay much attention to their physical activity, form fit, etc., or daily physical activity, at least 10,000 steps a day, etc., if they don't focus on this, there are high chances they get obese. Stress eating, okay, very common among teenagers and young adults. Stress eating, okay, overeating during stress could lead to, like when you're stressed, you want something to make you happy, and most of the people, they find these guilty pleasures via food. Okay, the food that is very accessible. So overeating because of stress induced overeating and all could lead to obesity. Then we have endocrine factor, any hormonal issues. Okay, like for example, hypothyroidism, hypogonadism, like when your gonads, that is ovaries in women, testes in men. Okay, with hypo means less functioning. So when your ovaries or testes are not functioning enough, they're not producing enough hormones, there are high chances you get obese. And in women, it's estrogen. Okay, estrogen is the main culprit here. If women who have too much of estrogen being secreted by their ovaries, there are high chances that you may be overweight or obese. Progesterone usually tends to slow you down. Okay, but progesterone does not add on to like increase in weight much as compared to estrogen. Menopause, pregnancy, puberty again, when you, if you are a parent of an adolescent child, you must have seen this. When your child is about to hit puberty, okay, a girl or a boy, okay, about to hit puberty, their focus on their fondness for food increases. Okay, because naturally hormones are increasing their hunger value, increasing their appetite, as well as their physically active, school, tuitions, etc. Okay, so you must have witnessed this. So these are some of the examples of endocrine factor. Then trauma, any head injury in which your hypothalamus has been injured or got affected. There is a damage to your hypothalamus. So hypothalamus is that part of the brain which will control your appetite and satiety. Okay, so that's the area of the brain which tells you, okay, enough, your stomach is full, stop eating. Okay, that's a signal what hypothalamus should be sending to your stomach and or to your actions. So you stop eating, you say that, okay, I'm completely full, I don't no longer require food, I'm done for today's meal. Okay, so when hypothalamus get damaged, this neurotransmission is affected. Okay, so people do overeat, they do not know when to stop, so that could lead to obesity. Then prosperity and civilization, as I have mentioned earlier, most of the prosperous countries or developed countries like UK, Russia, USA, okay, people who generally come from a higher socioeconomic status, not just in these wealthy countries, but in also in the underdeveloped countries, the section of the people who come from a higher socioeconomic class, the rate of obesity is much higher in this particular class of people. Then we have some drugs which promote weight gain, like some psychiatric drugs like antidepressants, steroid hormones, contraceptives in women, diabetic drugs, antihistamines for allergy. Okay, these things may increase your weight. Also, when women when they are trying this IVF treatments and all, in vitro fertilization, etc. So even in that cases, you may see women get obese quicker because they are induced with artificial hormones. Okay, so hormonal drugs play a very important role in gaining weight. Then there are some theories of how what is the foundation of a person getting obese. So there's a fat cell theory. So the number of fat cells you have in your early life, for example, when you are born, all children are born with specific amount of fat cells. Okay, this amount of fat cells may be determined by your genetics. Okay, if a child is born to obese parents, or a child is born into a family where obesity runs in their lineage, so what happens, the child is born with um, moderately more number of fat cells as compared to other children. Another reason to this is when in childhood, okay, in infancy, or when the child is growing up, when the child is even below 5 years of age, when the child was very chubby, bubbly, and when the child was overweight as compared to its peers, okay, it's known that the child naturally has higher number of fat cells as compared to its peers. Okay, so what happens is that the child, when grows up, this adipose cells or fat cells will not disappear. It's still in the body, even though the child becomes a very lean, thin person when they grow up in their adolescence and teenage year, and even into early adulthood. Okay, the child has shedded that excess weight during the childhood itself, and they have grown into a healthy, lean individual. But still, their chances of being obese in the future is much higher as compared to its peers, because the child was either born with extra fat cells, or the obesity which the child faced during its initial phase of childhood gave the child naturally more fat cells. So that is the fat cell theory. So obese children, they have more fat cells, and more fat cells means you can easily regain the lost weight. Okay, then we have the set point theory. This theory, this school of thought says that every person's body is physiologically regulated. Okay, and your metabolism will adjust along with your weight gain and weight loss. That is quite true. Okay, like for example, your body, the adaptability of body to sudden environmental changes is it's very something very special. Okay, for example, this entire week you were fasting. For example, it was for Muslims, how it is like Rosa, okay, the month of Ramadan, the holy month of Ramadan, okay. You may see the metabolic changes, okay, your complete food cycle has changed. Early morning and only after 7 or something, okay, and the entire day you're fasting even without water. Obviously, your metabolism has changed. Your body has learned quickly to adapt to this particular routine. Okay, so your body physiologically maintains or adapts itself to the sudden change in food pattern, sudden loss or sudden gain in weight. Okay, but then there is a set point. Okay, 5 kilos less or more, okay, or let's say 3 kilos, 3 kilograms more or less, your body can adapt to this new found weight, and it can adapt its metabolism accordingly. But beyond that, if you gain 6 kgs or 7 kgs within a month, obviously your body's metabolism is slowing down. Okay, or suddenly you have lost 6 to 7 kgs within a month, means something, so your metabolism is not in balance. Your body is wasting a lot of energy than what it is consuming. Okay, so this set point theory can help you reduce fat at set point with exercise. For example, we see this with regular customers, that they are for the first few months, like first 3 months or first 4 months of weight loss, they are easily losing weight. But after that, after this first 4 or 3 months of their weight loss journey, they find it so difficult, even with regular exercise and whatever has helped them so far, it's not working with that intensity, so or no more. Okay, have you experienced this? In even in your personal life, if somebody was in a weight loss journey, you must have hit a plateau. Initially it was very easy for you to shed few kilos, but later something happened that you are doing the same thing, you're not increasing your calories, you're doing that same amount of physical exercise, but you're not losing that additional weight. Okay, you seem to hit a plateau. Okay, you're not going below that. It does happen. The meaning being, you have, if you want to lose more, you have to like increase the resistance in your training. Okay, calories could remain the same, but you have to increase the resistance in your physical exercise. For example, just by walking 2 hours a day, 1 hour in the morning, 1 hour in the evening, and following 1,800 or 1,500 kilocalories per day, you have achieved a very good weight loss. But you have to shed that extra 2-3 kilos. That is very difficult for you. Do one thing: when you go out for a walk, even for that 1 hour brisk walk, add some weights on your ankles or wrist, or even nowadays you get this jacket weights. Okay, so what happens here is that your body, after you shedding that initial kilograms, will get used to the weight it has achieved, and the body does not think there is a requirement to change anything or come down to even a lesser kilograms. So now you have to trick your body. No, you have more weight. Okay, by adding few weights in your training and all, you have to trick your body that it's not true, you have not lost weight, you have to lose further more. That's why you are adding weights in your physical training. So resistant training will help you to lower down the plateau. Okay, so the main thing is, even with the problem Jolene Paradia has mentioned, you have to add resistance training in your regime. Okay, even when you're fasting alternate days, that is also a kind of intermittent fasting. But try to do this thing on the days when you're having food. Okay, on that particular day you can add resistant training. Okay, then we have another theory, that is hunger versus appetite. This theory is not mentioned in the textbook, but still we'll just explain it. What do you eat and how do you eat? That is what it means. Hunger is physiological. Your hypothalamus, it controls your hunger. Okay, hypothalamus will signal you, okay, you are hungry, go and have food. When you're having food, hypothalamus will signal you, okay, now you're no more hungry, you're satiated, stop eating food. Okay, so that is hunger. It's physiological. Okay, you can track down the physiology of this mechanism, hunger mechanism in your body, just like how you have a thirst mechanism between your throat and the brain. You have hunger mechanism between your stomach and your brain. It's physiological. Okay, but appetite is psychological. Okay, even though the body is hungry, the body wants food, but if you're undergoing undergoing some psychological trauma, you're undergoing some stress, anxiety, something like that, you will not feel like having food. Physiology is telling you to have food. Okay, you are hungry, you can hear your stomach making those sounds when it is hungry. Okay, that murmurs what your stomach makes, you can hear that, but still you are psychologically not ready to go and devour a food or a meal. Okay, so that is appetite. Appetite is completely psychological. Okay, loss of hunger, loss of appetite is different thing. Okay, when you are stressed, when you are anxious, your body obviously requires food, but you do not feel like eating. Okay, that is loss of appetite. Loss of hunger means you may have undergone some traumatic surgery in your stomach, or you have undergone some injury on your head, which led to breakdown of this hunger mechanism in your body. Okay, that is physiological. Okay, yeah, even if you can carry a bag while walking, or for example, if you do not want to strain your body that much, it's the better option is, like for example, the initial 4 months when you were on the weight loss journey, you were walking on plain surfaces. Okay, like roads or parks or something like that. Now you have to change your venue of walking. You have to go to areas which is slightly, which has a slight slope. element to it, slope. Okay, a small hill, like a slope, something that goes up. Okay, so instead of walking, you can add climbing few stairs. Okay, the first 45 minutes you will just walk on the plane if you can't find a slopy area or a hilly area nearby. Okay, you can definitely find some staircases. So 45 minutes spent on walking, 15 minutes spent climbing stairs, coming down again, climbing up the stairs. Okay, so this is like adding resistance to your daily regimen. Okay, it's not just necessary that you go out, spend money and get this ankle weights, wrist weights or chest weights. If you can't afford it, you have staircases free of cost. Okay, or slopes or a hilly area to do your walking. So even that can enhance your resistance. Next, coming to role of hormones. So in obesity, the fat cells and how the hormones work on this fat cells, on your hunger, etc., is very important. So first we have insulin. 80% of the obese people who already suffer from obesity, they have too much of insulin, and the highest, when the insulin gets secreted so much from your pancreas, that after a point of time your fat cells will not respond it. Okay, your cells or your body will not just respond. Okay, this fellow is always being secreted and coming and disturbing us, we will not mind him. That's what your body will tell to too much of insulin after a point of time. So what is that? That is becoming insulin resistant. Okay, when your pancreas has literally secreted out way more of insulin to help your body compact this extra fat, extra glucose, that there comes a point that the cells will stop responding to insulin. So that is insulin resistance. Okay, so that is quite high in obese people. So and even in weight loss, okay, effect on weight loss of insulin. So if you can improve your insulin sensitivity, if you trick your body with certain diets, okay, with certain diets, you starve your body from high carbohydrate diet and all for a brief period of time, and then you slowly introduce carbohydrates back, that's when your cells will start responding to insulin in a normal way. Okay, so when insulin sensitivity is established in your body, you will see that you have started to lose weight easily. Okay, then we have thyroid hormone. Free thyroxine levels is usually normal in obese people, but their the other T4 elements, etc., that is quite high in people suffering from thyroid issues. Especially hypothyroidism has minimal effect on long-term body weight. Okay, you must have come across this cases very often if you are a gym trainer or a dietitian. Women who suffer from thyroid issues, okay, losing weight is a Hercules task for them. That thyroid will just not support the losing of weight. So what you have to do here, the treatment what you suggest, like not just a dietitian, it is usually done by the endocrinologist. So the treatment here is they will try to decrease the amount of T3 hormones. Okay, and along with that, fat-free diet is suggested to them. So these are the only techniques that will initially help them out, but then yeah, lifestyle changes will also have to work. They can't tolerate stress. Okay, people with thyroid issues, they are advised to follow up with meditations, etc., and to live in a stress-free environment. That is the best option for them. Then we have growth hormone. The more the amount of growth hormone you have, it is easier for you to maintain your muscle mass, lean muscle mass, and lose weight. Okay, growth hormone enhances the production of lean muscle mass. So if you have lean muscle more in your body, automatically the fat cells will drop down. That's how you can stay in a lean, fit figure. Okay, with healthy lean muscle mass and lose weight. Decreased secretion of growth hormone could lead to obesity. So then we have leptin. Leptin is a kind of hormone secreted by your stomach. Okay, so if the leptin is too much, okay, that is what it leads to obesity. If you are able to reduce your plasma leptin levels through medications, okay, you can achieve weight loss. For thyroid, we will usually suggest to follow up with, you have three streams in India. You have three main streams of medications, that is allopathy, you have Ayurveda and homeopathy. Okay, whatever has worked for you in the past, okay, just follow that stream of medicine, and whatever guidance the homeopath or the Ayurveda doctor or the allopathy doctor has given you, you have to follow that. Okay, about the food, for example, if a person is suffering from hyperthyroidism, they can have cauliflower and other cruciferous food. Those who are suffering from hypothyroidism, they are not supposed to have specific kind of food. Okay, that kind of knowledge, the treating physician, okay, because the kind of advice, the kind of food advice you get from an allopath would be slightly different from homeo and Ayurveda. So whatever field of medicine you have chosen to treat yourself with, just follow those um, remarks and guidelines. Okay, give it a 6 or 1 year. It will not, the effects will not be shown immediately. Thyroid takes a lot of time to show up positive results. Okay, thyroid treatment with any branch of medicine. Okay, so you have to be patient. You have to give your doctor, physician, at least 6 months of time to see if the treatment is working or not, and then decide. Okay, so I will not suggest some specific morning drink or something like that until and unless uh, it is been told to you exclusively to follow. For example, if you are following some Ayurveda kind of management for thyroid, obviously they will give you some kashayams, some medicines, some churans, etc. They will give you specifically to have in the morning, mix it with hot water, lukewarm milk or honey, and have. Okay, they will give you the complete guidelines of what kind of food you should have. Okay, specifically to balance your vata, pitta, kapha, etc. So yeah, that kind of food related dietary guidelines, and especially at what time you should have the food, even that in Ayurveda you can get answers to that. In homeopathy and all, you will see restrictions to coffee or garlic. Okay, restrictions are seen because they do not promote having pungent foods or too much of aromatic food in your diet when you are preparing a food for a person who is undergoing homeopathic treatment. Okay, for people who are having acidity problem, first try to drink more of fluids. Okay, so more fluids in terms of juice or water, buttermilk, whatever. Okay, the goal here for you is that acidity means too much of concentration of hydrochloric acid in your stomach. How will you reduce the concentration? You dilute it. Okay, you dilute your stomach acids. How will you do that? The best action for it is have more water-based food like soups. Okay, like soups, porridge, oats, something like that. Okay, liquid khichdi. Okay, dal khichdi, that is semi-liquid in consistency. Okay, kannis and all, any ragi kanji or something like that, that will be quite beneficial for you, especially at night. Please don't consume solid food. Keep consuming some soup or some liquidy diet at night. Okay, the best thing to have at night for everyone is that irrespective of what kind of disease conditions you may be having apart from kidney diseases. Okay, for everyone at night, the best thing to have is a 200 or 250 ml bowl full of dal. Okay, untempered dal. Okay, just boil the dal with your favorite vegetable or just tomato. Okay, just boil it, smash it properly. Okay, have some lemon on it, sprinkle some salt according to your taste. Okay, and just have that dal soup. Okay, that's the best thing that will satiate you. Your protein requirements will also be met slightly, not completely. Okay, dal is not such a big source of protein, but still. Okay, and it is easy on stomach. Okay, dal is something that in every form of Indian cuisine we have incorporated different types of dal. Okay, Bengal gram, tuvar dal, moong dal, whatever. Okay, so your body knows to take care of it. So don't shock your system at night. Okay, at night your body requires to sleep, it requires to rest. So give it something that it understands how to metabolize. Okay, and having just dal, even without rice, just plain cup of dal aids in your weight loss. It satiates you. Okay, you will feel full. It will also work on your acidity because it is in liquid state. Okay, you're diluting your stomach acids with it. So yeah, that's about the role of hormones in obesity. So assessment of weight for male and female, the weight is given here in pounds. The height is given here in not centimeter, it's in feet and inches. Okay, so you can convert these weight into kilograms. Just use a Google. Okay, let's say for example a woman who is 5'4" in height. Okay, her target weight should be around 133 pounds. Okay, so just right now you can do it. Use your mobile phone and search, convert pounds to kilograms. Okay, you will get the answer to it. Just put it in the chat box what you have found. For the woman who is 5 feet 4 inch, okay, her target weight should be 133 pounds. Okay, so in kilograms, just do the conversion. Just Google it. Okay, and whatever answer you get, just put it in the chat box. Yes, the weight is 60 kilograms. So I guess if you take a screenshot of it, you will have an idea of how to convert this. I didn't find any details about centimeters and kilograms. It's the BMI index we have on centimeters and kilograms. But this is a very good source. You can just take a screenshot of it. It can help you and your clients to decide what is the target, what is the upper limit of your weight. You should not go beyond it, and lower limit, you should not fall beyond this. Okay, so this is a range. So yeah, this is the BMI chart I was talking about. So here again, see, if you see on this left side, height is given in feet, inches, also along with that in centimeters also they have mentioned. Okay, in inches as well as in feet, as well as in centimeters. And if you see the topmost area of it, weight is mentioned in pounds as well as in kilograms. Okay, so you have this colors. Okay, like blue means underweight, green means healthy, they are in the healthy range, yellow overweight, orange obese, and red extremely obese. So how to use this graph? Let's say somebody who is 5'8", okay, around 172.7 centimeter. Okay, a few centimeters up and down will also do, no worries. So and this person's 5'8", okay, remember the height is 5'8", and this person's kilogram is around 68.2 kgs. 68.2 kgs. Okay, so what do you think is their status as of now? Are they underweight, healthy, or overweight? If you combine, if you just draw a line from 68 downward and 58 sidewards. So 58 downwards, if you bring, the body mass index is 22. Okay, and we know that the body mass index between 19 and 24.9 or 24.5 is healthy. Okay, ideally it is considered healthy. So this is a healthy person statistic. Okay, so if you do not remember our BMI formula, or every time you have to open a calculator to collect the BMI formula, so this chart is very predictable. Okay, even without calculator, you can directly check what is the BMI scores. But remember this thing, BMI is very subjective in nature. For a generalized population, you can use BMI. But for when you're using BMI for individual consultations, even if you get a person whose BMI is around 25 or 26, doesn't mean that they are unhealthy. Okay, the terms which they have used here, okay, healthy, overweight, okay, these the terminologies may not be an appropriate way to measure their health. Okay, for example, even in sports nutrition we have discussed this. Athletes, okay, performing athletes, when you check their body mass index, you will never find an athlete who comes in the range of 18 to 24 or 19 to 24.9. Okay, most of the performing athletes have a body mass index which is between 25 and 30. Okay, so by when you follow the theory of body mass index, so all these athletes should come under the overweight category. Okay, not in the other category. So what happens here is, but they may be very fit. Okay, they may be very fit, and they are getting proper care in terms of their nutrition, in terms of their physical stamina, etc., as compared to any other healthy person determined by BMI. Okay, so BMI is not an indicator of health. Okay, you can use BMI only to justify a statement for a general population, a huge number of people. Okay, at individual level, you have to look at other vital statistics as well. Okay, so that is one drawback of BMI. This is a based circumference. Okay, there is a rule in Japan. I don't know if you have heard about it or not. Senior citizens, okay, usually when you cross the age of 40 or 50, all the adults, they have to, by law they have to go and get their weight circumference checked in a public health department. Have you heard about this law in Japan? This is a rule there. Okay, people in midlife or in later life, after they cross a certain age, I guess it is 40s or 45, something like that, after they cross that age in Japan, you have to go and regularly, annually, twice or something like that, you have to get your waist circumference, waistlines checked. If it is above the national health ideal range, you have to involve yourself into some physical training classes or courses to lose weight. So this is the law in Japan. Okay, by law, it means that government wants the citizens to regulate their weight. Okay, so this is a law. So yeah, weight circumference also plays a very important role in justifying that how healthy you are in terms of your cardiac health, mostly about your cardiac health. Okay, so females whose weight circumference is less than, see, about waist circumference we will talk in inches, because people wear jeans or they get trousers and all, usually you go by the inches. Okay, so in centimeters you may not understand, for example 32 waist, 30 waist, something like that, it is in inches. Okay, so we'll go by the inch value of it. So people, women who have a jeans waistline that is less than 27, they go for 26 waist size, etc., something like that, means they are very low. Their risk category is very low in terms of cardiac issues, etc. Okay, and for males, men who have less than 31-inch waistline, very low. And 27 to 30 or 35, if you're using a jeans or trousers between this range for women, okay, you are still healthy. If you have a low risk of obesity or cardiac disorders. For men, the inches are given here. If you cross 35 inches, okay, when you go shopping, you cross 35 inches for your lower body, okay, by getting jeans or trousers, it means you already are in the high risk zone of obesity as well as cardiac disorders. For men, it is above 39 inches. So this image is an image of a DEXA scan, okay? Dual energy X-ray absorptiometry. So that's the full form of DEXA. So as I mentioned earlier, BMI, it cannot tell you the amount of like the difference of fat content in your body and the lean muscle mass you have in your body. BMI cannot tell you that. Okay, but DEXA, when you do a DEXA scan, okay, most of the athletes, they get the DEXA scan done because they want to exactly know what percent of their body is fat, how much percent of muscle mass they have. Okay, to get that exact figures, they go for this DEXA scan. So you can see whatever is blue in color, okay, this turquoise light blue in color, that is the solid parts of your body, that's the bone. Okay, and when you go to the other end of the spectrum, yellow color, that is fat. Okay, so a person, usually a radiologist, okay, radiologist will understand just by looking at the amount of area spread in different colors, or you will get a column, a table of this analysis also. Okay, the DEXA will analyze the amount of percent spread out of different colors. Okay, and you will get that analysis in your report. So DEXA scan is used to understand exactly how much of muscle versus fat versus solid bone you have in your body. Then we have ponderal index. So it is the ratio of your height to cube root of your weight. And ponderal index, again, very rarely used, not that commonly used. Okay, it's a very complex formula. So a person who has an index that is less than 13 is associated with obesity. Okay, if your ponderal index is less than 13, okay, the BMI analysis machine is not required, because you have this apps or websites. When you Google it, just put the height and weight, these websites will give you the answer, okay, along with the report, are you obese, underweight, or not. Okay, so yeah, BMI analysis machine is not, I don't think so that is that useful as compared to DEXA. Okay, so ponderal index, you can if you're free now, you can just go to the Google and just search ponderal index calculator. Okay, you can do it right now. Ponderal index calculator. So you can put your height in centimeters, and or feet, you can choose. Usually in India we use centimeters, so that is ideal. So did you do that? Did you yourself ponderal index? Did you get the answer? So anyone who got less than 13, okay, any figure like 12, 11, 10, something like that, it means you are obese. Okay. If you have got more than 20, 25 and all, you're healthy. Okay. 45 and all, you may be underweight. Please check again. Okay. So that is ponderal index. It's a modified BMI calculator. Okay. So then next you have waist to hip ratio. Women who have the waist to hip ratio which is less than 0.80 or below, they have very low risk for heart diseases. Okay. Waist to hip ratio is what? Your waist divided by your hip. Okay, that is waist to hip ratio. Waist is, for example, your jeans size, whatever denim size you use, your denim trouser size or your regular pant size, whatever you use, take that as your waist. Okay. And if you have a measuring tape, you can do this later. If you have a measuring tape at home, calculate the measure your hips. Okay. Hips are different from waist. Waist is where your pants can sit comfortably, not the low waist or the high waist jeans, the regular mid waist jeans. Okay. So where your pants can sit comfortably, okay, that is your waist. And hips is the it's the most elevated part of your buttocks. Okay, just take the circumference of that part of the body and do your waist to hip ratio. Okay, so depending on your gender, you can just check what will be your risk. Okay, so if you have a low waist to hip ratio, it's much better. It means your health is on point. So naturally people, women or men, okay, women and men, they both have pear shaped bodies. Okay, so people who have pear shaped bodies, okay, that means you have wider hips and buttocks as compared to your upper body, that is pear shaped body. Okay, so naturally they have low risk for cardiac disorders. Then you have avocado shaped body, when a huge amount of fat is near your belly. Okay. And in apple shaped body, your entire torso, okay, not just the belly but your entire torso is heavier as compared to your limbs. The ideal body weight, we have broca index. Broca index is very easy to calculate. Okay, like whatever is your height, okay, whatever is your height for men, okay, for men you can just subtract 100 from your height. Whatever answer you get, that should be your ideal body weight. For women, okay, whatever is your height in centimeters, just subtract 105 from that height. Whatever answer you get, that is your ideal body weight. In your textbook, it is given that both men and women, they have to use the same formula, that is subtracting only 100. Okay, but some articles, they have slight variation for women that I have mentioned on screen here. That is, most of the articles, they say subtract 105 from the woman's height. That should be her weight. For men, they can keep it to 100. It is very easy. For example, let's say somebody's height, okay, a man's height, adult man's height is 180 centimeter. 180 centimeter. What should be the ideal weight for this person? Man's height 180. Okay, now adult woman, her weight, her height is 165 centimeter. Okay, according to the formula on screen, not in textbook, on screen, 165 centimeter. What should be her ideal weight? It should be 60 kgs. Yeah, so this is the most easiest way to find your ideal body weight. You can do your own. Okay, so you will understand which weight you have to maintain. If there is 1 or 2 kgs or even 3 kgs less than or more than your ideal weight, doesn't matter, don't stress much about it. These fluctuations do take place. Okay, especially for women, throughout your menstrual cycle your weight will fluctuate. Okay, as soon as you get near your menstrual date, okay, like in your luteal phase, Those who are from medical background, you will understand when you are in the luteal phase means ovulation has took place, your ovaries has released the egg. After that there are 2 weeks with you. In that 2 weeks you will be gaining a lot of weight. Okay, usually it will be water weight, edematic water weight. Okay, and as soon as you attain your menstrual cycle, when your periods start, the next 2 weeks, okay, when estrogen is higher and your body is in a shedding phase, you will lose a lot of weight. Okay. Of obesity for PCOD female, it's not the diet options I would suggest, it's a lifestyle option. Okay, your lifestyle has to be healthy, physically active. Okay, along with that, a healthy diet, healthy balanced diet is what I would suggest for a woman suffering from PCOD, because it's not just your diet, but it's more about your lifestyle. Okay, your lifestyle changes can bring about a lot of positive effect in your living with PCOD period. Okay, it's not just diet alone can't heal the side effects of PCOD. It's lifestyle changes you have to bring about. Then obesity, different classes of obesity. You will find this a similar table in your textbook also. I don't know which page number in textbook. Somewhat similar table was there in the textbook. I don't remember the page number, but you can read about it later. Yeah, there are different classes of obesity. If you are 30 point, if your BMI index, okay, if your BMI is around 30 to 34.9, it means you are obesity class 1. Okay, if your BMI goes beyond 40, okay, you are class 3 obesity. You may require a gastric bypass surgery. The most efficient management of people who are in obesity class 3, usually, okay, by default they can go for bypass surgery, gastric bypass surgery. So next, coming to adipose tissue. Adipose tissue in apple shape, brown shape, okay, and different types of adipose tissue, that is pink, white, and brown. Okay, so the white adipose tissue is related to your central control metabolic rate. Brown adipose tissue it defines the impact of hormones. Okay, too much of hormones can reduce or increase the brown adipose tissue in you. Pink adipose tissue is related with women. Okay, pink adipose tissue is the fat gain during your pregnancy and fat loss during your lactation. It's usually guided by the pink adipose tissue. So android and gynecoid kind of body figures. So the gynecoid one on the right side, that is pear-shaped body. Okay, you have small visceral fats around your pelvis. Okay, like it will not affect your cardiac health or any heart-related issues. It is very benign in its function and commonly found in females. And usually, when a woman has a pear-shaped body, not every woman has a pear-shaped body, but usually when a woman has this wider hips, thighs, and buttocks kind of body shape, it means that during her pregnancy, these extra fat which is there on her upper thighs, buttocks, and hips, that will be utilized for energy requirements during pregnancy and even during lactation. Okay, so there are high chances that if you control your diet enough and you give yourself enough protein and carbs from the diet, okay, and for fats you rely on your body, you can lose your extra weight which you have gained on the hips, thighs, and waist during the pregnancy. Okay, you can easily lose that weight post pregnancy. And for android kind of body figures, upper body is obese. There is too much of adipose tissue around your belly, and these people have the highest risk of hypertension, insulin resistance, diabetes, dyslipidemia, that is cholesterol imbalance, and coronary heart diseases. Okay. Then we have juvenile onset obesity. It develops in infancy, as I mentioned earlier, when a child is leaving breastfeeding and going into the weaning diet, and parents overfeed the child since they're 6 months of age or 1 year of age. That's a developing period of juvenile onset obesity. Okay, or in childhood. Increases it in this case, your adipose cells, that fat cells are higher in number. So this satisfies the first school of thought, the fat cell theory, which we have gone through recently. So adipose tissue cells have a very long lifespan, and they need to store fat. Okay, even if you are losing weight, even if the adipose tissues are emptied out of fat during your fat loss journey, it doesn't mean that your adipose cells will disappear. It's still there. Okay, you can't kill your adipose cells. It has a very long life. So this is what it makes difficult to lose weight. So some people who can lose weight, but more than that, more quickly than losing weight, they can gain weight. Okay, they can gain double the amount of weight what they have lost. The reason being is that their adipose tissues was still active. Okay, the causes are your poor dietary patterns, lack of physical activity. Okay, 43% of adolescents watch at least 2 hours. Nowadays it is not much about the TV, it's more about your usage of smartphones. Okay, so yeah, not just TV, but yeah, just sitting and playing video games, or just scrolling through the web, sitting in your room and not moving around, not going outside, not witnessing the world outside, etc. That could lead to juvenile onset obesity. Adult onset obesity develops in adulthood. The number of adipose cells will not change much. Whatever adipose cells you had during your growing age, the same adipose cells will be used for giving you obesity later. So, but these adipose cells are larger in size. They can store a lot more of fat. And if the weight gain continues, then only the adipose cells number will increase. Otherwise, no. Okay, so people who were never obese during their childhood or infantile stage, and if they have just begun to be overweight, it's easier for them to find a lifestyle change and never be obese again. Okay, but if you don't discontinue your lifestyle changes, if you keep on harnessing like the bad food habits, you not only will have larger adipose tissue, but you will have more number of adipose tissue. Okay, so strategies of weight loss, management, and the foundation and the management we will discuss later, because there is a formula which we have to discuss here. Okay, that we will discuss later. Today most of the students who are writing exams have not participated, so that we will keep for the next week. Okay, so this is an important formula that I will be taking next week. The strategies of weight loss, that is all the management, six management principles are there. You just have to follow that for weight loss. And there is a formula, so with the help of which you can find an ideal calorie intake based on you, based on your individuality. You can find an ideal calorie intake based on your gender, height, weight, age, etc. Okay, so we'll discuss that in the next class. Even underweight, people suffering from underweight issues, even for them, next class we will continue the same topic in part 2.